presented with symptoms of upper respiratory infection, so sneezing, coughing, watery nose, nasal discharge, and eye discharge, and lethargy.
Yeah, the more we think we know, the more maybe we don't when it comes to this virus. And it actually ties in. There's actually a really nice, really good question asked by one of the biggest critics of me on Twitter. He was wondering if I had any comments on the New York and UCLA antibody studies, talking about some of the stuff in the first segment. And they're hopeful. They're interesting. That we had so many people that might have had this, where you have many multiples of people with the antibodies, and obviously they've been okay. They ended up getting through it okay. And it supports the idea that there could be a bunch of different strains of this thing out there. That one Chinese study that was spiked recently, suggested there were 30 different strains of this thing. And maybe that's possible. Maybe some are benign and maybe some are killers. Who knows? In the meantime, we are here to talk about our pets, our furry friends, and what this might mean. Joining us is veterinarian Dr. Jennifer Frione, and she's from the Lakeside Animal Hospital. It's her practice. LakesideAnimal.com is the website. Dr. Frione, thank you for taking the time with us. All right, so what do you make from your standpoint of what we've come to learn about our furry friends being susceptible to COVID-19?
Yeah, so right now, obviously, there's still no evidence that our pets can transmit the virus to us. Now, while yes, there are pets that are becoming positive with it, it seems like they might be a dead-end host, though, and they're not able to transmit it back to us, which hopefully is some good news.
The one thing I haven't heard of is COVID-19 having horrible effects on the animals that have been diagnosed so far, the big cats at the Bronx Zoo, or in this case, these domestic cats. Is that your understanding at this point?
Yeah, correct. So what we're seeing so far is mild upper respiratory infections, and cats in general are very prone to getting upper respiratory infections. It's one of the most common things we see for them, even before the COVID-19 virus. So if anyone was going to get it, it would have been them.
So you bring up an interesting point. It ties into where I was going next. We're talking about COVID-19, but what about other viruses? Even the traditional H1N1 flu virus, for example. Is there a situation where we give it to our pets, or they could give it to us?
So again, there's just so much unknown as to whether or not that we can give viruses to pets or the other way around. However, it is definitely possible. So when a virus mutates, it's possible that it can jump to another species. Again, however, at this point, there's absolutely no evidence that pets are able to transmit it to other people. But we are asking people to take an abundance of caution if they are ill with the COVID-19, and to have another house member care for their pet, or if they must care for their pets, then to use caution, use good hygiene skills, wear a face mask and gloves when handling your pet, just to prevent any spread.
When this whole thing first came up with the lions and tigers at the Bronx Zoo, ended up looking into this a bit further, and didn't realize until I dug in that 70% of identified contagions that we become sick with are actually zoonotics, or contagions that are originally derived from an animal somewhere along the way. Might not be our pets at home, but somewhere along the way they came from animals. Is it possible that often when we do have illnesses, whatever it happens to be going around, that there is more spreading of it with animals than perhaps we realize?
Sure, I suppose it's possible. Absolutely. Zoonotic diseases are something that as veterinarians we are always cautious of. It's one of the reasons that I consider us very essential. We're, sometimes the first, the indicators of some potential zoonotic disease, in which case we need to report that and hopefully get it under wraps before it gets bad.
And just in general, I know you can speak to your practice. What's the lay of the land with vets right now? Are you still able to care for animals the way that is necessary?
We are. Right now we are taking the necessary precautions, though. We are doing curbside only, meaning clients aren't allowed in the building. And all of our team members are wearing PPE to protect not only themselves, but also our clients.
Well, we appreciate it. Thank you very much for the time and the information.
Absolutely. Thank you.
Again, that is veterinarian Dr. Jennifer Frione from the Lakeside Animal Hospital. Her practice, lakesideanimal.com. All right, now,